It's Shannon Janice. I'm working on the CARE4 team as applications consultant for community-wide. So I've been on the team for over a year now, back in January. I have been at RVH for almost 17 years, certified in health information management. So this has been, I've been involved in both Meditech upgrades. And so this has been a fun one to revamp the whole system and work with the partner sites and customize and standardize our registration process. So I am going to go through first an inpatient registration and then as well as an outpatient recurring registration. So I will shut my camera off and then flip over to my screen. So it looks like everybody can probably see that okay. So I have emulated Clerk so that my menu isn't as large and you don't get too confused. So we go through our administrative menu into registration and then the registration management desktop. So we're presented with our main home screen where we do all of our registration functions. I'll talk about the right-hand side menu a little bit after I've gone through the registration. So we've got our registration type. Wherever there's an arrow, we can select the drop down. So this is new for Expanse, where we have not the registration types. They're the same, but we have standardized our questionnaires according to the registration types across the partner sites. So depending on what type of patient you are registering, the questionnaires are slightly different with the relevant required material data elements that are necessary to collect. So I'm going to go through registration inpatient. I have, because this is a direct registration that I'm doing, I have pre-registered the patient knowing that they're coming to our facility. So we have the CARE4 inpatient registration, patient identifier. Whenever we have a health card, that is our recommended #1 method of searching. We can search by name and date of birth as well. So I'm going to put in the patient's health card number. Put in this one. 2, 5, 3, 4. So we do have a direct link to the Ministry of Health to validate our health cards. Of course, that's turned off at this moment. So I'm presented with the patient lookup. These are search criteria up at the top based on health card number. Best match records found based on a weighted range. So you can see I'm in the blue criteria, best possible match, total records found based on my health card number. You can select these little icons. If you select the little eye icon for information, it will just give us a little bit more detail on the patient, demographics. You can see here that this patient has had visits to both RVH and GBGH. So RVH's V number and GBGH's medical record number, as well as demographic information. And then over here on your visits, we can see that the patient has had a visit. This one's highlighted, so this is in a pre-status. If I scroll down, we've got GBGH ER registration as well as an RVH ER registration. If you select this little 25 here, we've got 25 matches based on this patient's information, total records found. So I'm going to select this patient here.
How do I mute it?
Special indicators has already been entered on this patient, so this pops up automatically. Special indicator malignant hypothermia, who entered it last and when the last edit date and time was. And then you can see the active account list here. So patient, like we saw on the other screen, had a previous ER visit at RVH, and this is the pre-inpatient for post-surgery for today's date that I'm going to be registering. So now we're in the registration screen. So we've got our header up at the top with patient's information. New with Expanse, as you're probably all aware of, is that it's mixed case. So everything is not in capitals anymore. So we do have uppercase and lowercase. We've got the patient's name up at the top, age, gender, date of birth, which is day, month, year. We've got an admission inpatient, which I'm going to be starting. registration date and computer time. Special indicators are identified in red up in the header. Count number, health card number, and the V number over here on the right-hand side. So the, excuse me, the asterisk fields are mandatory, which is required for this inpatient questionnaire. So we've got the account number, and we already have this because I pre'd it in. What's new for Expanse is the name. The name data field is not one field for the last name, first name, middle name. It's separated out into 3. So we've got patient's last name, first name, middle name. It is still 30-character field length, and we do validate with the Ministry of Health. So what the patient is registered as with the MOH is what needs to be entered in to Meditech. And of course, if we put in as much as we can. If we run out of room, we put where our 30 characters will take us. Date of birth, age, birth sex, marital status, language. Even though these aren't flagged as mandatory for this questionnaire, of course, if they were entered previously, their demo recall fields, we wouldn't obviously want to take those values out. Our health insurance, we do have the ability to enter confidential right into the patient registration. Previously, this was in a different menu. And then what's new on the patient tab is the other names, the preferred name that the patient prefers to go by. So we're no longer putting in brackets in the name field. So over here is where we would enter, oops. If patient goes by the first name Steve or preferred name, we put in our type, and this is his preferred name. So then it'll be in brackets up here in the header. So that is where we're entering the preferred name that the patient wants to be called. Next tab is the IPAC tab, so infection prevention and control. I'm just going to say no to that. So these are queries that IPAC has asked us to put on registration, and these will enter over into PCS interventions tab for IPAC to review. So we've got our history of falls. There's drop-down menus for all of these queries. So we've got our no fall in last 90 days, 1 fall, fell in last 31 to 90 days, greater than 2 falls, not able to ask. So I'm just going to choose no. Did you travel outside of Canada in the past 14 days? This is a yes or no query. Confirmed case of COVID-19 or close contact with confirmed. Again, it's a yes or no query, or not able to ask. COVID-19 test in progress, or had a recent COVID test. Sorry, this one. Oh, sorry. New or worse cough, shortness of breath, fever, shakes or chills, new onset of vomiting, diarrhea in the last 48 hours. Again, these are all yes, no, not able to ask queries. Do you have a history of C. diff? And then down here we have, do you currently have or have had a history of any of the following? And there's a drop-down list for our different infections. So I'm just going to cancel, and you don't have to. If there's no history, then you're not obviously putting anything in there. Then we have our address tabs. This is where the patient lives. Asterisk fields are mandatory. I spelled Georgian wrong. Feature that we have always had in registration, but it's important to note that we have a direct link with our, sorry, not a direct link, it's in our MIS dictionaries for postal codes. But when a patient's address changes, really important for the clerical staff to be entering the postal code in the city field. And this will populate the relevant city, province, postal code, and the residence code. A lot of times we get address updates, and clerical staff are forgetting to update the residence code. So it's a real important feature to be entering the postal code in the city field. That only works for Ontario address. And we do maintain that postal code dictionary in the MIS dictionaries. Phone number, you don't have to type in the hyphens. F9 for our different phones. So I'll just choose cell phone, see what everybody has these days. You have the ability to enter multiple phone numbers. And we have our email address. So I've already entered one in there. Contacts tab. So I'm getting an update because I changed the cell phone that was in there when I pre-registered. So now I've entered a new phone number and it's asking me what do I want to keep. So I'm keeping the final phone number. So I'm going to say okay. So now we're on the contacts tab. So this had already been entered in previous their demo recall field. So previous visits will obviously populate this information and they can be updated. We no longer require demographic information, address. We just require the contact type, the name and phone number, and the relationship to patient. This is where it's entered down here. So if I wanted to delete primary contact information, I could just go in here and delete these values. So we have primary, secondary, and then we also have the option to add, with your little plus sign, substitute decision maker. So of course, if a patient only has a substitute decision maker, then that would be the only one entry that's going to be in there. And if you want to delete anyone, you just have to highlight and X the. So if I didn't want to have his brother in there anymore, I would just highlight and delete that. Guarantor is patient or a person responsible for paying a bill, should there be a bill. So patient, we have multiple different rules around guarantor. So this is related to the finance side. So patient is his own guarantor. And then we have all the address information on this tab. This is where mail would go to from a finance perspective. So it's important that we always have this information updated and correct as well. Insurances. So these are available insurances for this visit today. So patient's covered with OHIP. So we're adding that to his insurance visit. And then he's going to be an inpatient. So we're going to make this patient have supplementary insurance because he'd like to have private room. So if we add, it is a lookup. So of course, if you did an F9, you're going to get A to Z. I know that Green Shield is the mnemonic for the secondary insurance. So we've got the Green Shield information here. Subscriber. So if we did an F9, we have the option to choose our patient as a subscriber. The insurance policy is in his name related to his work. And then we've got our policy information. So if we I'll just make up a policy number for this patient. So that would be added to his insurance screen to be able to, for finance to bill private or semi-private coverage. WCB tab is for workers' compensation. So if this was a workers' compensation claim, we require accident date. This field is giving us a little bit of trouble right now. It's not active, and we require the employer information. It is a lookup. So if we did F9, we're going to get every employer from 7 to Z. So if we wanted to look up an employer that started with an R, F9, and it'll just take you to the employers that start with an R. So if we wanted to choose that he worked at RBH, then we would select that. Again, it's asking me, I didn't have a current employer in there. I've updated it to RBH. Is this what I want? I'm just going to cancel that because I don't want to add workers' comp. So then we have collection notes, and this is a tool that we can utilize to identify any notes on this patient account that would help finance in address or demographic information and or insurance. So if I wanted to, if my patient wasn't sure if his Green Shield coverage actually supported semi-private or private, and I wanted just to make finance aware of that, I could put in a new registration note. And I'm going to choose insurance, and I'm going to add a text. And I'm just going to put in a note, patient is not sure if Green Shield has semi or private coverage. So then that would just let finance be aware to follow up with the patient on that. And so we utilize notes for a lot of things on our registrations, whether patient is visiting in town and staying with the sister, or You can, patient gives consent to speak to mother about these problems, or patient can be reached at this number for the next 14 days, like different contact information or queries based on really helping finance with any registration related queries. So then we've got our timestamp, the user, date and time, and what the note is. So then we have our provider tab. So this is created and standardized for an inpatient registration that requires the admitting provider. So I've already entered that because we knew the patient was coming. Dr. McKenzie was admitting the patient. Any fields that are grayed out, you obviously can't get to. So emergency provider isn't relevant in this case. And then the attending provider is also going to be Dr. McKenzie. So if I start typing McKenzie and F9, will give me my provider list. This populates, so you can see the values up to KEN. So I can arrow up and down to choose my providers. I can toggle over here by mnemonic. So this is the only one with this mnemonic, and it's the first 3 letters of the last name. First 4 letters of the last name, first initial of the first name. Then we've got name. So then it'll go by name order and then phone and license. But we tend to search by name or mnemonic. So if I went by name and I wanted Dr. McKenzie, looking for Scott, Jeffrey. And then we have our family provider. So this is a demo recall field. So patient's provider was already in there, Dr. Haynes. Of course, we want to ask this information every time. We want the reports going to the right providers. So if this was not the family's provider, they changed providers, then again, we would start typing. So if we were looking for Dr. Bedard, F9, we tend to tell clerks to obviously keep the search a little bit broader in, especially if you don't know how to spell a patient's or a provider's name. So if we were looking for Dr. Bedard, again, I can see that he's right here. And when you highlight these values, we're also confirming the information down below. So provider address information and basically office details. And then you can see specialty here is family practice. So if I wanted to choose that, other providers we use for specialty providers, if this patient was referred into from a specialist and he wanted that report to be going to the provider, or in the case of children being seen by pediatrician or oncology patients that are being followed in the city as well, and they want their reports to go to the oncologist in the city, then it would be entered there as well. Then we have our visit tab. So this is specific to an inpatient admission. So all of our asterisk fields are mandatory. So we've got our admit category. F9 will give us our different values, and there's different criteria on when you would select what admit category. This particular admit category relates to urgent. These values also flow over into our coding software that the coders abstract. We've got arrival mode, so how the patient presented to the hospital. So if this patient came by ambulance. Entry code, this is a direct registration from institution. So if patient was sent from South Lake, so South will give us our options. Next page, South Lake Regional. And then by ambulance is a yes or no. So this is a yes field. So I'm processing the admission today and now. Surgical service, I'd already entered that. We do have our options of our different services here. Room preference, he wants a private room. And room, being in Bed Allo, I would probably already know what room he's going to, but I can do an F9 and filter based on service. Or I can do an F9 and choose the unit. So you can see this room is identified as dirty because that's the one that I'm highlighted on. So up and down will show me my options. So if I chose this room and this bed here, so it automatically pops in. This bed was built and identified as semi-private room. And then the reason for visit was already entered in there as well. So post-surgery, I just made that up, another location. Then we have our pharmacy tab. So this is a preferred pharmacy where patient has a preferred pharmacy where the medication and prescriptions go to. So it's a lookup as well. So F9, if I wanted to say that the patient goes to Shoppers in Barrie, the best way to search for a pharmacy is mostly by phone number. It will bring you right to that hit. So we tend to tell patients, clerks, if the patient has any prescriptions or pill bottles or anything with phone number on it, it is easy to identify those little pharmacies in grocery stores and little privately owned pharmacies that sometimes you're not sure of what the actual name of the pharmacy is. So if I do search, then I have all my different Shoppers Drug Marts. So if I chose the one here on Yonge Street, just hit OK. So now we've got patient's preferred pharmacy. This can be edited and updated also in the PCS documentation. Preferred. And then we're on special indicators. Clerical staff cannot enter special indicators. Clinical staff, privacy, IPAC, and security can enter special indicators. Just so happens I've got a lot of access right now and I can enter it for you. So I'll show you how it's done. So if we selected a new special indicator, F9, oh, you know what? It's because I emulated a clerk and this clerk obviously doesn't have access. So the list is related to your infections, your dates and times with infections, falls risk, care plan. I think a few of the other demos talked about special indicators, violent patient. So there's a multitude of different special indicators. And again, it will allergies, it will populate up here in the special indicators in red. And then as soon as you're registering, that obviously pops up as well. So then when I save it, we've got our information here. So demo inpatient, account number, fee number. And then I would be presented with chart and label printer, which is going to be set up according to clerical staff where they are assigned to. So the printers will populate, and then you can print the patient armband and labels. And then I'm back to the registration desktop here. So menus on the right-hand side. When I go over recurring outpatient registration, recurring visits are things like oncology, dialysis, physiotherapy. You do the one registration, and then when the patient comes back, it's a simple revisit every time. So it's a quick revisit to their account. So that's the revisit routine. These routines here, bed request, transfer, leave of absence, and discharge, are also available on the bed management desktop. So of course, bed requests when they want to admit patient into the hospital, it goes over to bed allocation. Transfer routine is used to spacebar enter recalls your last patient. My keyboard tends to be sticky and doesn't necessarily work. So if I put in his V number or his account number, sorry, I can transfer service, I can transfer room, I can transfer to different units, and your transfer reason. In the new system, it's going to be, it used to be that you can also transfer your attending providers, but that's going to be on the provider responsibility to do those transfers. So that's your transfer routine. This is also available in the bed management desktop. Then you have your leave of absence. So if you're inpatients going out on a leave of absence, and there's rules around that. Outpatient bed is utilized for one particular event, putting an outpatient clinical registration into an inpatient bed. Those are our PEDS medical transfusions. And then discharge is discharging the account from Meditech. Patients going home. I don't know why that's not working for me. So if I was discharging patient, discharge disposition gives us our options. Of course, we would select accordingly, and then that would discharge the patient from Meditech. It's all happening in real time. Then we have our edit feature, so we can edit our, I'm not even going to try spacebar enter. We can edit any values in our registration. So it basically brings up exactly what I just did. So if I needed to make an edit to the birth date or the patient's name, address information, adding a different contact, editing the family provider, or I chose the wrong admit category, or any one of those values is on the edit feature. Fix event is fixing a few different options. I can fix the registration type. I can, in order to cancel a registration, I would first have to undo it in the fix event. These features are a little bit different in the new Expanse versus our current. So this was a fun one to learn. So I would have to first undo it and then cancel it. And then I could also fix registration type. If patient was registered inadvertently as a surgical daycare, needed to be an inpatient, or our moms and babes, sometimes we have to unlink mom from babe if there was an error. And so fix event, there's a variety of different routines and functionality that can happen in here. So if I was canceling a registration, I'd first have to undo it, and then I would have to go to my cancel routine and then cancel that registration that is in pre-status. When you try to do something in the menu, you get stopped. As you can see, you got an error message. So obviously I cannot cancel a visit that has been registered. First has to be undone to pre-registration. We do have more pop-ups and alerts to identify. It's kind of more in your face. When, if we were to go register duplicate registration, it would be right there letting you know that there is an admission, like you shouldn't be continuing on and creating a new one. So less room for error and duplication. View, oh, I first got to delete that. View is just actually viewing the registration without the ability to change, edit, or correct anything. So exactly what we went through. History will show us the values. So I've got activity date from today, from the 26th to today, included data fields for registration. So if I compiled this, it would show me exactly what happened. So on the 26th at just before 2 o'clock, I registered this patient. So it shows you every, I don't think there's anything that I changed in here. It would also show you if you edited new values to old values. Here's an edit here. So it was a pre, so that was the old value. And then the new value was obviously I registered it. So it would show you any edits to any of the other values as well. Providers, I deleted Dr. Haynes. And new value was Dr. Bedard. You can also include data fields for patient and insurance. You have to compile. This is a really great feature because it really identifies exactly in the current state. It's a report, and it just kind of groups your edits into a generic and you don't really see what was changed. You have to go digging a little bit. So now this is a great feature to be able to see what the old value, new value is for each field. So that's under your history. And then of course you have any forms and EMR. So that's the inpatient registration. There's some feedback, I'm not sure why. I'm gonna now register our outpatient recurring registration. So this is going to be a new registration type. So this is a recurring patient identification, health card number. I know. So this patient is not in our system. This patient, not in RVH, sorry, it's in our Expanse system. I had previously set this patient up as a patient in Collingwood. So you can see they have an M number, their MRN number at Collingwood. But it is my patient, health card match. So I'm going to select no active counts list, so brand new patient to RBH. New account. So we've got our last name, first name, patient's middle name. They've identified over here that the patient goes by their middle name. So again, we have middle name bracketed up here in the header. So everything is pretty much the same as what you just saw. Hopefully that warning stops coming up. So we've got our IPAC. A lot faster to, you can type yes or no and it will, in tab, and it will just populate for you so that you don't have to keep doing the up and down arrow. So if this patient has since moved, I always struggle with making things up. So change the address. So the residence code was still the same. So phone number, contact information. So now I've updated from previous address to current address. Primary contact information is still the same. So patient is telling me guarantor information, insurance, patient has OHIP. So of course, if OHIP wasn't validated, we would call the Ministry of Health to, we have access to call and give the ministry our validation code. We give them some information, patient's name, date of birth, health card number, validation code that's populated, and they let us know yes or no whether patient has, or it would be a yes because we would be getting a no, and it's usually an updated version code. So if the ministry did say no, patient doesn't have valid insurance, then we would just take off OHIP and patient becomes a self-pay. And then there's other required requirements that patient requires no patient responsibility form, and we let them know that they're going to be responsible for this visit. They need to get to the ministry, update their health card, call finance back in with their version code, and then finance will reverse the charges and correct the account on their end. So this is a standard outpatient registration oncology, so none of this is required. So if this was an issue of the insurance, so it's insurance, text, MOH states no valid coverage, advised patient to present to the ministry. That lets finance know that why do we have OHIP on file, their OHIP card, but we change it to self-pay, and it's for that reason. So providers for recurring require a primary care provider. So this is the primary oncologist that follows the patient. So if I'm looking for Dr. Presnell, name, so that they would book the patient into oncology as much as they can with Dr. Presnell, of course, unless he's out of the office or on vacation. Presnell, and then if they had a family doctor, so you can see we obviously don't have attending or admitting because that's not relevant to our outpatient recurring registration. Our locations for outpatient, if we did an F9, we'll get the whole list of our different outpatient locations that we register to. So this is the cancer program. Service date and time is of today, and then our reason for visit. These are free text fields, so I'll just put, they have standardized reason for visits that they like to enter. Pharmacy, so this patient doesn't have a preferred pharmacy entered, so I'll add one. I like shoppers. Okay. Preferred. And there's no special indicators on this patient. I'm just going to backdate that. I have the option to do that because I'm going to put in a revisit for today. I backdated that registration for yesterday. So again, we've got our outpatient, our account number, our V number, and then we're presented with our armband and labels. So in those patients, that's a long come back. It's just a short revisit. Let's see if my space bar actually works. Write that down. So we can see our total visits have been 1. The initial date and time was yesterday to oncology. And now today's revisit date. I just hit today. Now. And then should be Dr. Presnell. Of course, he can change it. And then location to cancer. In those areas, they have a routine, oncology patients come 3 times a week. Generally, they get to know their patients. Of course, they ask if anything has changed. They get to know their patients, and patients are identify if they've moved or anything's different. If they needed to go into edit anything, obviously, on their health card, if they need to update the version code or change their address information, then that's when they would go into the edit routine. Oh, why that's not working for me. Spacebar enter does work. Recalls the last person that you were working on. And then they would just go in and edit their demographics, update their version code, validate their health card. But the revisit is just kind of like a quick visit to get in there. So that was inpatient and outpatient registration.